The molecule, the hormone, dihydrotestosterone, made from testosterone, is the hormone primarily responsible for facial hair, for beard growth. As well, it's the molecule, the hormone, primarily responsible for lack of hair on the head, for hair loss. So how does that work? Well, DHT circulates in the body, and it binds to DHT receptors in the face to promote hair growth. But it binds to DHT receptors on the scalp to promote hair loss. And if you look at somebody, everyone can predict whether or not they're going to go bald based on looking at we're always taught, our mother's father. So if your mother's father was bald, there's a higher probability that you're going to go bald. The pattern of DHT receptors on the scalp will dictate whether or not you're going to go bald everywhere or just in the front, or so-called crown-type baldness. There are many accelerators on hair growth, but the first one that I really want to underscore is blood flow itself, which equates to the delivery of nutrients and oxygen. This is very important, and it explains a lot of the treatments for halting and reversing hair loss. For instance, one of the longest standing treatments for halting and reversing hair loss is so-called minoxidil. It was actually a drug that was developed to treat hypertension. So this is a cardiac drug that lowers blood pressure, and it does that by causing vasodilation. It allows more blood flow, not just to the hairs on your scalp, but to hairs everywhere on your body. And indeed, most people don't realize this, but minoxidil won't just slow the loss of hair from your scalp. It is also effective at slowing the loss of hair elsewhere in your body. And I should also mention that there are two major routes by which people get minoxidil to the hair follicle. One is to take it systemically as a pill, where it goes into the general circulation. The other is to take it topically as a cream. There are prescription and non-prescription forms of minoxidil. The ranges of oral minoxidil that you'll see out there and that people take range anywhere from 0.25 milligrams all the way up to 5 milligrams per day. The topical minoxidil is also found in various concentrations. The typical concentration is going to be a 5% concentration that people will use once per day. The dosage ranges of the oral minoxidil are tremendous, 0.25 milligrams all the way up to 5 milligrams once per day. The dosage range of the topical solutions tends to be a little bit more confined. Typically, it's a 5% solution, and it's recommended that people use it one time daily, maybe twice daily. It's also important, by the way, if you're going to take this route, that you actually leave that solution on the scalp for 3 to 5 minutes. This is important and should make complete sense as to why it's important. You can't just rub the stuff into your head and then rinse it off and expect it to be absorbed. It actually needs to seep down into those hair follicles and access the niche. How do people arrive at the correct dosage for minoxidil? In some cases, it's accomplished by finding out that you have an unwanted side effect, like dizziness or swelling of your ankles or edema or something that suggests there's hyperprolactinemia. Perhaps notice a drop in libido or some lethargy. I would hope that if people are working with a physician, or if they're not in taking minoxidil, that they would start with the lowest possible dose. So for oral minoxidil, that would be 0.25 milligrams, and then increase it as needed rather than jumping in right at 5 milligrams. And nowadays, there are more and more doctors who are familiar with this requirement for blood flow, understand the mechanisms by which minoxidil works, and understand the vast desire out there for people to hold on to the hair they have and regrow hair. And they're prescribing things like low dose tadalafil, so 2.5 milligram to 5 milligram tadalafil. The use of low dose tadalafil to slow rates of hair loss is very much, in a logical, mechanistic sense, exactly the same as the logic of using minoxidil to slow rates of hair loss. It's all about increasing blood flow to support the stem cell niche below the hair follicle. Microneedling, as the name suggests, is taking a bunch of little needles, either in a little stamp, so a little square, or nowadays typically it's a roller. So it looks like a paint roller, except it's got tons of little needles in rows all over that roller. Those needles range in length from 0.5 millimeter to 2.5 millimeters. Microneedling has been shown to do two things. It has been shown to reactivate semi-quiescent populations of stem cells that are in that telogen phase, putting them back in anagen phase, and thereby stimulate more hair growth. It has also been shown to be a very effective augment for some of the hormone-based hair regrowth. Not surprisingly then, an increasingly common treatment for hair loss is Botox. Botox is the brand name for what is otherwise known as botulinum neurotoxin. Is a toxin that's a bacterial toxin that serves to cut the protein that leads to synaptic vesicle release. Botox injections can be applied to the scalp in order to relieve tension of the scalp. It's decreasing the squinting, if you will, or the tensile nature of the scalp skin so that more blood flow can arrive at that stem cell follicle area. Caffeine does many things besides stimulate our central nervous system and make us feel less sleepy, however. One of the things that caffeine does is it is a fairly potent PDE inhibitor. It indirectly stimulates IGF-1. Why? Well, because PDE can suppress IGF-1, and by ingesting caffeine or by applying topical caffeine ointment or cream to the scalp, you can suppress PDE sufficiently enough to increase IGF-1 and increase some hair growth, or at least maintain hair growth in that region. Keep in mind that no one has really explored the dosages of caffeine in these ointments in a systematic way. We're still in the early stages of all this, but I do think it's important to mention caffeine because of the lower incidence of side effects, at least reported side effects, and the general safety margins and the head-to-head, essentially comparable efficacy with minoxidil, because minoxidil has a bunch of other issues. So there's one very direct way to increase hair growth and maintain the hair that you have on your head, and that's to increase IGF-1. That can be accomplished through prescription drugs such as growth hormone and things that stimulate the release of growth hormone and IGF-1. Keep in mind, growth hormone is released from the anterior pituitary during the first hours of sleep, especially when you haven't eaten anything for the 2 hours prior to sleep, and especially when you get regular bedtimes. Yes, this is a real thing. If you are going to sleep at variable bedtimes, especially if you go to sleep much later than your usual habitual bedtime, you will miss that growth hormone pulse that normally occurs in the first 2 to 3 hours of sleep. And yet, they also have problems because they can increase growth of small tumors that normally might be eliminated. So there is an increased cancer risk with growth hormone treatments and IGF. The other thing that's really important for maintaining proper hair growth, this anagen phase, is that you need sufficient iron. This is because iron and ferritin play a key role in the cell growth pathways that go from the stem cells to the stimulation of keratin within the hair itself. The levels of iron that you want are somewhere between 25 and 100, and for men, somewhere between 30 and 150. Now, one substance that we know can inhibit 5-alpha reductase, although it does it pretty weakly, is saw palmetto, which is an extract of the saw palmetto berry. The good thing about saw palmetto treatment is that it is known to have very few, if any, side effects. There might be some side effects in about 1% of people, but it's not associated with a lot of side effects. It's also known that when taken at about 300 milligrams per day, taking anywhere from 200 to 500 milligrams of saw palmetto, but most of them focused on about 300 milligrams of saw palmetto per day, divided into 2 or 3 doses. Why? Well, it has a relatively short half-life, meaning it's going to get cleared from the bloodstream, and more importantly, its biological action is going to be very short-lived. So if you can get a hold of 50 or 100 milligram capsules or tablets of saw palmetto and divide those up, taking them in the morning, afternoon, and evening, or even just in the morning and evening to achieve a total of about 300 milligrams per day, that's going to very likely help you hold on to some of the hair that you would have otherwise lost, maybe even grow some new hair. Another commonly discussed and used commercial compound for offsetting hair loss and stimulating hair growth is ketoconazole. Sometimes this is known as Nizoral, where Nizoral is the brand name of a shampoo. Ketoconazole is an antifungal that was initially developed to treat dandruff and severe psoriasis. So ketoconazole has been shown to be effective in increasing hair number. It's also been shown to be effective in increasing hair diameter. Well, ketoconazole can disrupt some of the fungal growth that, frankly, we all have on our scalp all the time. I know this is a surprise to many of you, but you are constantly bombarded with viruses, bacteria, and funguses all the time. Now, exactly how this happens isn't really clear. What is clear is that the use of ketoconazole shampoos 2 to 4 times per week with a scalp contact time of about 3 to 5 minutes has been shown to give about an 80% response rate of maintaining hair that would otherwise be lost. They'll start using ketoconazole shampoo. Again, the typical recommendation is 2 to 4 times per week with a scalp contact time of 3 to 5 minutes and really rubbing it in and then rinsing it out. You don't need to be super vigorous, but you want to make sure that it gets down into the follicle and around the follicles, not just sitting on top of the hair, which is going to be especially important for people who have long hair to really massage it in. Well, they will experience a growth of hair in that particular region that almost certainly were due to miniaturization of the hair follicle and reduction of the total population of stem cells in that follicle, as opposed to complete loss of the stem cell population. Now, if you decide to use ketoconazole as an approach to offsetting hair loss, it's very important that you get a hold of a shampoo that's at least 2% concentration of ketoconazole. This is important because a lot of the ones that are available out there, especially online, are going to be 1% or lower. So you want to try and obtain a ketoconazole shampoo of 2% or higher concentration of ketoconazole. I should mention that there are occasional side effects with ketoconazole. The rates of side effects from the meta-analyses and reviews that I read were somewhere between 1 and 8% of people will experience some side effects. But those side effects tend to be pretty mild. Things like irritation of the scalp, things like thinning and brittleness of the hair that sometimes can be offset by using shampoos that contain things like biotin. Finasteride is effective in reducing DHT because of its actions in reducing the type 2 isoenzyme or isoform of 5-alpha reductase. Finasteride reduces DHT. That's the net product of finasteride. And in doing so, it can increase hair count by as much as 20%. In addition, finasteride treatment done properly can reduce hair loss in 90% of all people that take it. And in addition, it's known to increase hair thickness by about 20 to 30% overall. The issue with finasteride is twofold. First of all, it is known to have some pretty significant side effects if it's not dosed properly and in particular populations of people. So when people take finasteride, some people are very strong responders and they achieve really effective hair regrowth and maintenance of hair. Other people, less effective, although still pretty impressive, but the catalog of side effects that people experience at a given dose varies widely. So there's a lot of trial and error that has to take place. Dutasteride is yet another molecule similar to finasteride, but remember those 3 isoforms of the 5-alpha reductase enzyme? Well, it inhibits all 3. The typical dosage of oral dutasteride, get this, 0.5 milligrams to 2.5 milligrams taken orally, works 2 to 5 times faster than typical finasteride at inducing hair regrowth, and reduces DHT by, get this, 95%. And that can occur at concentrations as low as 0.5 milligrams, although you will see prescriptions and people taking dutasteride anywhere from 0.5 milligrams all the way to 2.5 milligrams orally. Now, not surprisingly, dutasteride is associated with a lot of side effects related to the DHT pathway. So things like reduction in sex drive, reduction in overall drive. It also tends to impact other hormone pathways, so increases in estrogen, prolactin. That's why gynecomastia, male growth of male breast tissue, sometimes occurs when people take dutasteride. And so you're probably asking, why would anyone take dutasteride? Why not just take finasteride and wait for that hair growth? Well, the answer is that people are often very impatient, and it turns out that dutasteride works about 2 to 5 times faster than finasteride. Now, the holy grail of all this hair stuff is in understanding that no one specific treatment is magic. And in fact, there are now a number of good meta-analyses comparing the various treatments we've talked about today alone or in combination. And we can summarize that pretty easily by saying that combination treatments that involve a mechanical stimulus and a chemical stimulus are always going to be better than either one alone. And within the mechanical category, the stimulus that seems to work best is microneedling. So the combination of microneedling and finasteride can lead to some pretty robust and impressive hair regrowth.